Namaste and welcome to another edition of Doctor Fitness. So today is the first topic we talk about in our elderly or geriatric care. We will be talking about urinary incontinence. Urinary incontinence is the involuntary loss of urine, much to our dismay. Sometimes this is preceded by just an increased frequency or increased urge to urinate also. So when I talk about these geriatric care topics or elderly care topics, I mostly have in mind patients and families who do not have or have limited access to comprehensive home health care program where somebody is supervising a team of nurses, physiotherapists, doctors, everybody else all under one umbrella. So this is for those places that do not have comprehensive access. An example is places in India. So I will be talking about symptomatic treatment of urinary incontinence. So since urinary incontinence is caused by multiple problems, we will not be addressing all these issues. This is, if I may say, tips how to take care of people with urinary incontinence. I do want you to remember that this is absolutely not a substitute to any doctor's advice or any healthcare provider's advice who is involved directly in your family member's care or in your care for that matter if you are the elderly person we are talking about here. So please use common sense when watching these videos and just use this as another tool or guidance in your healthcare. So let's start with some basic information about urinary incontinence, such as causes. So we need to understand the cause of urinary incontinence before we treat it, right? So the first and foremost is urinary retention. I'm going to talk about this in the beginning because treatment of urinary retention is completely different from other causes of urinary incontinence that we're going to talk about. Urinary retention is when a bladder is unable to evacuate itself or empty completely, almost completely, like it should under normal circumstances. So when a lot of urine is just sitting in the bladder, it tends to leak out. It has to find a way to come out, right? So it causes urinary incontinence, and frequently this is missed. So your doctor can do an ultrasound to figure out if you do have urinary retention as a cause of urinary incontinence. Frequently in men, this is caused by prostate enlargement, diabetes, and other neurological conditions such as stroke or spinal cord problems. They all can affect the nerves that connect the bladder, right? So the treatment is completely different. Now, some other causes of urinary incontinence can something be as common as a urinary infection. So a lot of times elderly people, or especially ones with diabetics, can harbor pus cells or bacteria just like that without actually causing an infection. So just because you have this doesn't mean you have an infection. Your doctor will be able to tell you if this translates to an urinary infection and then treat you accordingly. Severe constipation can also cause urinary incontinence, and it's fairly easy to treat. So that needs to be treated as well. Now let's come to some of the main other causes of urinary incontinence. So number one is stress incontinence. So this is more common in women as they get older. So they have weak pelvic muscles, abdominal muscles, they have hormonal issues, they've had babies. So all of these can cause weak pelvic muscles leading to urinary incontinence. So this is manifested by leakage of urine every time they cough, they stand up, they sit, they jump, they try to exercise, things like that. So the other cause of urinary incontinence that is quite common is urge incontinence. Urge incontinence is manifested by frequent urge to go to the bathroom for no reason. You've just gone to the bathroom, but you feel like you have to go and void again. So this is urge incontinence. So this is caused by a little bit of bladder irritability as we get older, and also bladder capacity or capacity to hold urine diminishes as we get older. So the next very important cause of urinary incontinence is functional incontinence. Now, functional incontinence is very common and can coexist with the other causes such as urge and stress incontinence. It can coexist. So functional incontinence is inability to access bathroom or not knowing that you need to urinate. So this can happen with dementia. Patients may not know that they need to go void or empty the bladder. It can happen with severe mobility issues such as arthritis, neurological issues, Parkinson's, stroke. Anything that affects your mobility can limit your access to the bathroom. You're not able to get up and go to the bathroom as quickly or as often as you want to, so leading to leakage. Some of the causes that your doctor might discuss with you is the use of certain medications. So certain medications like diuretics or Lasix are very important for you, and you should not be reducing the doses, stopping it without consulting your doctor. Certain medications, which is very strong anticholinergic medications such as Benadryl and certain cough and cold medications when taken in high doses can also create havoc on your bladder and cause incontinence, and you and your doctor should be aware of that. So now let's proceed to some practical tips. These are all mostly behavioral modifications, how you can deal with urinary incontinence and make it less frustrating for yourself and your family members. Now, there are medications that your doctor may try for certain kinds of urinary incontinence during extremes of cases. There's also surgical procedures that are available for urinary incontinence, but of course we are not going to discuss all that today. I'm just going to give you some tips and some behavioral modifications which go a very long way in helping you deal with this issue. So number one, like I told you, do not drink too much water or too much liquids during the second half of the day. Number two is pelvic floor exercises. So pelvic floor exercises are very important in improving your pelvic floor muscle strength, and I will be posting a link below to help you do these exercises correctly. These are especially important for women as they get older. So number three is what we call timed voiding. So frequently patients come and tell me that, every half an hour they have to go, but there's nothing in there, right? So I tell them to do timed voiding. Initially, I tell them to put an alarm or a timer for every hour and a half to 2. And whether they want to go or not, I want them to go urinate at that time. So of course, you don't have to do this through the night, but during daytime, I want you to do timed voiding. That really helps, and as time goes on, after a few weeks you'll be able to increase the timer to perhaps every 2.5 to 3 hours and go for 2.5 to 3 hours without voiding. So number three is to avoid a sudden urge to run up and go to the bathroom. So let's say you feel like urinating, but you know that you've just urinated, there's really nothing in there. So I want you to avoid suddenly getting up and hurrying to the bathroom. So urge incontinence usually comes as a wave. Just like a wave comes, touches the shore and recedes or goes away on its own. Just like that, urge comes and goes away in a few minutes. So I want you to take a nice big deep breath when you get an urge to urinate, sit down, and then after a minute or two, take your time, go to the bathroom and empty yourself and come back. So this you do it along with the timed voiding and other behavioral recommendations that I have suggested. So number four is to improve your general strength. Okay, so if you're very weak, if you're very frail, whatever you can do to improve your general strength will also help you with your urinary incontinence. You can do leg exercises, you can do standing exercises, whatever you can do, or you can just try sitting up in bed if you're bed bound. Anything that will help you increase your strength. Of course, a lot of these behavioral modifications are difficult to do in somebody like advanced dementia, but most people, even with mild to moderate dementia, a lot of these behavioral modifications can be adapted, especially things like timed voiding. Number four, if you have functional incontinence or if that is contributing, always make sure that a bathroom is close to you. Okay, so move the bed a little closer to the bathroom, or if there's a lot of mobility issues, patients are very frail, I always suggest a bedside commode. It goes a long way in decreasing dependence for adult diapers, reducing incontinence and all the frustrations that comes with it. So it's very simple to have a bedside commode, and every 2 hours a person, even with dementia, can be encouraged to just get up and sit on the bedside commode, and that really helps with urinary incontinence. Number five is wear clothing and underclothing that is very easy to dress and undress. So you should not be using anything with ties or anything like that. Something with elastic, something that's easy to dress and undress goes a long way to help them do their job as quickly as they can. Sometimes use of diapers is necessary, especially when you're traveling or especially when you're recovering from a surgery or you're going through a very tough time. In addition to all of these, using a diapers is necessary. However, using all the behavioral modifications will reduce your dependence or the frequency of diaper use. So urinary incontinence is a very common cause of care home or nursing home placements in the elderly because caregivers find it very hard to deal with. Also, patients go into depression, they become reclusive, they don't want to leave their homes, they're very embarrassed by urinary incontinence. So there's definitely treatment available for urinary incontinence. It may not be a quick and easy fix, but definitely these behavioral modifications will go a long way in helping you deal with urinary incontinence. I hope you find this video helpful. If you do find this helpful, please share it with your family and friends who may have elderly care at home. And of course, you all know that we also have a fitness channel for middle-aged to elderly people. So thank you and namaste.